This is the Emergency Medical Minute, sponsored by Health One. Okay, so this comes right from the list that you guys want for medical minutes. So let's, first, thank you for telling me what you guys want. So not everything I talk about is opioids. So you walk into a room, let's say it's room number 8 right there, and the patient is up and they're going, and they look like shit. What are you thinking? What are you thinking? Let's say they've been feeling bad for a day or two, and you walk in and they look like that. DKA, great. What else would you be thinking? Why is that person? Yep, it says not anxiety. Say they don't have like carpal spasms and stuff. But what should you be thinking about when you walk in and someone is that tachypnic? And what's that called, by the way? Small breathing, right? So what should you be thinking about? And DKA has it right at the A. That person is profoundly acidotic, right? So that's how you're trying to get rid of like bicarb, which is this light acid, right? So your body is trying to compensate for a very profound acidosis. So you walk in like that, you see a patient who's breathing like that. What should also pop in your head? What's the list of things? And this is a very well-known kind of acronym of things to run through. Not an acronym, I guess. Yeah, differential. What's your differential for a person who's acidotic? Lactic. So there's a thing called MUDPILES, and it kind of does a good job of summarizing the different things that cause high anion gap acidoses, right? So on that list is methanol toxicity and metformin for M. U is uremia. D is diabetic ketoacidosis. P is paraldehyde. I is INH and iron. L is lactic acidosis. E is ethylene glycol, and S is salicylate, right? And if you don't remember that, don't worry. Just Google MUDPILES. These things all pop up for you. So let's give you more history. So this is an obese guy who, let's say, has a history of diabetes, and he had a CT scan done a few days ago as an outpatient, and he's continued taking his diabetes, and he's also been having nausea, vomiting, and diarrhea before, which is why he got his CT scan. So what do you think he's got? More coffee, people. Come on. So he's got diabetes, right? So what diabetes med, common diabetes med, can lead to a profound acidosis? Metformin. There we go. So Stephen, metformin. So someone put metformin toxicity, so let's talk about that. So metformin is one of the most common diabetes drugs, really great drug in terms of treatment of diabetes, improves survival, and decreases heart disease, all this other really good stuff. But when people start getting into situations where their kidney function is compromised, then metformin can cause metformin toxicity, which is a big problem. If you're really, really sick from metformin, your mortality rate is between 30 and 50%. So you walk in and that person is small breathing, they're profoundly acidotic. Their mortality rate is almost 1 in 2, right? So they're sick as crap. And what is the treatment for metformin toxicity? Fluids, so sure, fluid resuscitate them. Oftentimes they're not eliminating their metformin, which is eliminated through the urine, right? And really, there's no antidote in terms of a medicine you're going to give. It causes this really profound lactic acidosis. So you can, if their, for example, pH is around 7, et cetera, you can start them on a bicarb drip. But the one antidote, or the one thing you need to remember, is metformin toxicity, which is sick as crap, needs to be dialyzed. So we'd be talking with toxicology. It's a dialyzable toxin. So we'd actually try to put a dialysis catheter and get these people to dialysis to hopefully survive. So metformin toxicity happens in 2 flavors. One, you've been on it a long time, and then suddenly your kidneys get bad, and that's how you get toxic. Or 2, you overdose on it, so it's intentional. And obviously, if they've overdosed on it, there's other therapeutic options, for example, like activated charcoal if it's within the first 2 hours. But really, the treatment you should think of is, do they need bicarb, fluid resuscitate them, and then do they need dialysis? Okay, metformin toxicity. We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.